No, he's got a mask on.
Here, show him on video.
It's all about him today, people. She said he'd be a little grouchy without a cigarette.
Oh.
So she's either going to hit him with a heavy rolling pin or give him a cigarette.
No. Yeah.
Relax.
He's kind of grumpy today.
Yeah.
That's
great.
Ooh, yes. Yep, we're good.
Yeah.
This is Terry before.
I think we're good.
Ready? Come on out here. What's up, girlie? Great, right?
Right.
Well,
He's.
you gotta understand, we're silly. We love to celebrate this kind of thing, and so we all kind of look forward to it all day. So we wanted to, because I always kind of ask, tell me scale of 1 to 10 in front of everybody, your pain level today. 0, nothing, 10, excruciating. 0 pain. And we did that, but good. So no pain today at all. All right.
I slept all day yesterday.
Well, good. That's awesome. That's what you want. Okay, and then you know, the other things that I typically like you here, what I remember us talking about is just you kind of had to be selective about what you were eating and chewing and kind of limited a little bit. What you'd say why you wanted to do this?
Because I lost that tooth
Yeah.
and I wouldn't wear the upper partial. It was just terrible. I hated it. I hated it. And don't wear the bottom. You really can't eat much.
Gotcha.
Because it's been like 1/4-inch chunks or something.
Right. Right.
And I thought it was maybe even affecting my health.
Sure. Eat and chew and the nutrition that you get from that.
I was just so tired of messing with dentists. You're a dentist or I don't know, you're That's why I was sighing in there because I was looking at that light up there. Dentist again. And you were doing your stuff without me having to have all them painful shots first.
Good.
So
Better experience.
I'm
and just-
ready for. I thought I was ready for something.
Yeah.
It's nice.
Yeah, that's awesome. Well, I'm going to look, if we'll pull up the x-ray, just kind of in general, our plan was, you know, your sinus cavities, this dark areas back here. We had treatment plan to put 4 implants. That was kind of the plan going in based on where that was, and then we went and did the surgery. So we should have another x-ray there. So you can see in terms of where the actual implants are, they're in front of the sinus. We've spread those 2 out, so you've got really nice spread and link to the implants. So overall, really good spread. I'm really pleased with how the surgery itself, like I told you yesterday, I mean, it went just ideal. I didn't really have any concerns. You did great. So I really feel like long-term we're in. So before we reveal, I definitely always want to say thank you if possible, and I'm telling you, it's hard work. It's just there's just a lot of details to it, and if somebody doesn't do their part, it just makes it really hard. And I've got the best team in the world, so I want to say thank you to them for sure.
Thank you, guys.
For sure.
Now wait, we're gonna do it.
Yeah,
here
yeah,
first.
let him
Not
see.
this step. Okay, so when you're ready, take off your mask. Now these we can still change a little bit, so don't worry. But this is kind of where we're at today. So I kind of like for you to look at it. Ready?
They are pretty.
Pretty, pretty.
They look good. Talk right?
Mm-hmm.
He always puts his mouth over his teeth, you know, when he talks.
Right.
Mm-hmm.
Well, when you're missing the front teeth
I know.
and spaces and all that,
And
it's
he don't want to show his teeth, too.
Right.
He just, they look good, babe.
Mm-hmm.
They're better than mine. Mine.
hey, that's right. They do. I think they look really good. And
He always
really
tells me
natural.
I have beautiful teeth. I have pretty teeth.
You do.
You do.
And, but my teeth are, you know, I've got braces. That was in the all straight.
Yeah, well, they're pretty too. They really are.
But I take care of him.
Yes, ma'am. Absolutely. I love
He
it.
needs to brush.
Well, we're working on it. We're getting better and better. Over all of that stuff for the first couple weeks, we're going to using the rinse. After we're done with that, I'm going to show you how to clean under them, how to do the flossing. There's a water pick. We'll go over maintenance. But right now, first 2 weeks, you're just rinsing. This is the celebration part, because you kind of get an idea if you remember what the teeth were before, kind of a little discolored, a little longer ideally than what I think fits in your mouth and different things. So that's kind of the and she'll show you kind of how things are now. Oh, before and after, and
Wow, you'll be
So-
smiling all the time, won't you?
and truly, I mean, if we want to change anything in terms of the finals, you'll let me know. These are sticks, they stay in your mouth, don't come in and out, you don't have to worry about any of that. We on this first part, don't bite stuff for this first 3 or 4 months. Talk through all that in a couple weeks.
And he needs to still not smoke, right?
For the rest of his life.
Something about that. Did you ask him about that? Something like that?
No?
Well,
She's just mentioned it
it's
in passing.
truly the way that nicotine affects the blood supply. It will have vasoconstriction, so you'll have less. But I don't judge habits, and I get it. So it's you will heal better and do better. But it's your money and your investment, and I don't.
Nicotine patches, they did.
Concentration of nicotine directly in the oral cavity, so it's better if we can avoid that. And patches are way better. Yes, sir.
You got
So,
one.
yeah.
He's being great
There you
today.
go.
And truly, do it as long as you can. I mean, the longer you get with it.
Good.
So, all right. Well, very good. We're happy.
Yay.
Nicolette has something for you.
Yes, so here's a little bit of a couple of foods that you can have. And just
Okay.
as a thank you for letting us, a little something as a thank you for letting us take care of you.
Oh, wow, thank you.
You're so welcome.
Wow.
Thank you.
I may have to borrow that. I like the fish too.
Maybe he'll
Have to go pick something up, right?
Yeah,